Hi, so today's Facebook Live is about Fibroblast RF, and I'm recording it, so I'll be looking at both cameras, and it's perfect timing because I actually just did it on myself this weekend. So if you look up close, I did it on Sunday, so I have the little scabs. Some of them already started to fall off, and I did quite a bit. So I did, like, obviously under my eyes, my eyelids. I did some spots on my forehead, like my 11s and my lines. And I also did like removal of some imperfections. So these were hyperkeratosis, which is like excess growth of skin that tends to happen as we get older. And then I also removed some hyperpigmentation. So those are those darker spots because it's a little different technique. I did my smile lines. I did like some spots up here, some hyperpigmentation spots. And I also did my neck. So the treatment that I did is Fibroblast RF. Sometimes people call it plasma. They're a little different in terms of the machine that's used. So this Fibroblast RF is a skin tightening technique. You create these little like dots that on the skin, but it's actually like an arc of energy that gets pulled by the fluids in your skin, and it stimulates the fibroblasts, which are responsible for the elastin collagen web that we have in our skin that supports our skin. So it actually helps in the production of collagen and elastin and increasing that interweb space to make our skin tighter and more full. So it's ideal for loose skin. So that's why like the wattle's really good under the eye. As we get older, that gets loose. Our eyelids get loose. And also a lot of people need it done for their jowls. So it's great for skin tightening. But if you have deeper wrinkles, it won't remove them completely, but because it'll stretch out the skin, it'll soften those lines. And that's where we do like the forehead lines and the smile lines to kind of tighten the skin and soften those lines. The difference between the plasma and the RF is the type of machine that's used. With the plasma, it's more of a cautery device, which goes deeper into the dermal layer and is a little bit more traumatic. So the results are more like you can get better results with one treatment, but the healing takes longer, and it's more of a cautery. So it's just more trauma to the skin, takes longer to heal, and it's more painful. Whereas the RF, it's a radio frequency and it's a little bit more gentle. So sometimes you'll need multiple treatments, but it's a lot less painful, it's more tolerable, and you heal faster. And we do numb your skin when you're going to do these treatments. So most people don't feel any discomfort, but everybody's pain tolerance is different. In terms of who can get this done, we go by skin tone. So like there's like 6 levels, and it's fine for people with skin tones 1 through 3. I'm actually a 3/4, but because of my genetic like heritage, I'm considered a 4. So people that are 4, you have to be careful when you do this because you actually have to prep the skin. So we use like a melatonin inhibitor to prep the skin for several weeks before the treatment and then for several weeks after. And you absolutely have to use sunscreen. It is not a good treatment for someone darker than me, like a level 4 or 5, because you are more prone to hyper or hypopigmentation from doing these treatments. The machine, like I said, it's a radio frequency. So the one I use has like a little tip like this. And then you just like barely touch the skin, if at all. And like it actually, your skin will pull the heat from it. And that's how it works. In terms of questions that people have, so it is permanent. What you're doing, it's not a temporary thing, but we do continue to age, so you do have to continue taking care of your skin and doing either other types of treatments or products to help maintain the results of it. Most people end up needing 2 to 3 treatments. It kind of depends on your skin and your age. So my skin is not super loose, so when you see my before and after, it's not like, oh my gosh, but I notice it. But someone who has more like loose skin, their results are like more dramatic, even with one treatment. So I'll try to post some before and after, or you can message me and I'll post some before and after of some results. I also have some on my website, myperfectskinclinic. Other questions, so it's permanent. How many treatments are required? Again, it depends how much tightness you need. So some people are fine with one, some people end up doing like 2 to 3. And in terms of prepping for it, if you're a skin tone of 4, you definitely need to do the melatonin inhibitors. Other people don't have to, but you have to use sunscreen. And in terms of the healing process, these take on average 5 to 10 days to heal or fall off, the little scabs. The oilier you are, the faster they fall off. So on me, I have dry skin, so it'll take like about 7 days for them to really like be mostly gone. My skin looks kind of oily or greasy right now because you have to keep them hydrated with antibiotic ointment and also Aquaphor. You don't want them to dry up, and because they'll flake too deep or they'll peel too deep and actually take good healthy skin, and you don't want that. You only want like the scabs and dead skin to fall off. So it looks kind of bad, but most people don't even notice it, really. I mean, I've been coming to work all week with this, seeing clients, and no one has really noticed unless I point it out. So my circles are dark because I can't use any eye cream or makeup right now. So that's the other thing. You cannot use makeup until the scabs fall off. Because your skin has to heal and you don't want to get infection. So you don't want to be using brushes and different products. You can only use the antibiotic and the Aquaphor. So there is a little bit of downtime with this treatment in that sense. So you have to be prepared for that. So a lot of people get it done like on a Thursday so that they can still like maybe have Friday off and go back to work on Monday or Tuesday, for example. In terms of contraindications, there's like the typical contraindications with anything that's machine based. So people that are diabetic or have heart conditions or pregnant can't do this type of treatment. So definitely you don't want to pick at your skin. You want to let it heal naturally. And then if you need a retouch or need to do it again, you would want to wait 6 to 8 weeks because you want your skin to be fully healed before you get it done again. And the prices and so forth are on the website if you want to check that out. But it's basically by area. So like a small area would be like the under eye or up here or here. That's a small area. And a medium area would be like half of the neck. And a large area would be the full neck. So this part and the underneath. So if you have any questions, feel free to message me.